President Trump reinstating the presidential fitness test, but not before joking about his own workout routine. Listen to this.
We're thrilled to have so many young athletes here at the White House in the Oval Office on this magnificent spring day. And it is indeed a beautiful day to celebrate America's athletic traditions and champions in physical fitness and all of those things that I work so hard at on a personal basis. I work out so much, like about 1 minute a day max, if I'm lucky.
The president bringing back the program as data shows 14 million children in the U.S. are obese, while almost 9 million are at risk for the disease. Joining us now to discuss this is family and emergency medicine Dr. Janette Nesheiwat. Dr. Nesheiwat, thank you so much for joining us. So it was a busy day at the White House for the president. And a little bit of fun there because he got to hang out with some kids. And for those who didn't do this, I certainly did when I was in grade school. The presidential fitness test, it's a 1 mile run. You could either do sit-ups or curl-ups, pull-ups or push-ups, the shuttle run and the sit and reach flexibility test. So what do you think about the president reinstating this after former President Obama got rid of it in 2013? Will this increase the fitness and health of young people?
Hey, Carly, good morning. Yes, absolutely. I think this is great because it really puts a spotlight on physical health at a time when too many kids are just inactive. So we need to get kids off the couch, off the phone, off the screen, and get them moving. This will help build resilience, motivation. It will build up their confidence. And then we'll see, healthier BMIs, for example. We will see kids that are no longer obese or overweight. As it is right now, 1 in 3 children are either overweight or obese. And some schools don't even have PE, Carly. Some schools maybe give kids 20 minutes of physical activity a day, and children need at least 60 minutes a day of physical activity so that we can avoid those long-term chronic health problems that we're seeing on the rise.
Well, several athletes also joined the president during this event yesterday. It had a little bit of everything, including some familiar faces. Watch this.
Thank you to the President of the United States for helping reestablish this presidential fitness test.
But I've never seen a president that loves the country as much as you do.
Thanks, Mr. President. Thank you to the cabinet members for this opportunity to be here. Thank you, Bryson, to allow me to be in this elite company of people. It's a pleasure to meet all you guys.
I think this will improve the overall physical health of our young people, but I think it'll also help the mental health of our young people as well.
So those are the pros, but Dr. Nesheiwat, the cons of this and why it was originally alleviated is because there are people who believe that this test shames unathletic children, or, the kids who can't run the mile or have to walk it or can't do the pull-ups. And then, they're in gym class, they get made fun of, and it just leads to a whole lot of negative for them in their lives as a result of this. So what do you think about that?
Yeah. I think when implemented properly, this is something that ultimately is going to provide education on health, which will result in lifelong healthy habits. Early childhood habits usually persist into adulthood. So this is about building confidence. And it's not just about a test. A test alone is not going to reverse chronic diseases, Carly. We also need to incorporate regular routine daily activity in addition to good nutrition, which means access to whole foods. We have to make sure we combat those socioeconomic factors that create barriers to good foods, good nutrition, and a routine that's, good for the child, whether they're at home, whether they're at school. So in the long run, if we can have consistent, healthy habits in early childhood, that is going to help prevent diabetes, hypertension, cholesterol, cardiovascular disease. And that's the main thing. I love that they focus on the basic fundamentals of cardiovascular endurance, core strength, and flexibility. Remember, Carly, what's the #1 cause of death in this country? Cardiovascular disease.
Absolutely.
So we're tackling it at a young age.
Well, Dr. Nesheiwat, there's also this that we got to get in. I find it very encouraging. It has to do with eggs, but there was a new study that shows that eating them regularly can significantly reduce your risk of Alzheimer's. This could be an entire segment in and of itself, but in the 30 seconds we have remaining, can you just sum up this study for us, what we need to know about it?
Yeah. Sure, absolutely. So this study followed 40,000 participants over 15 years. And what they found is if you ate 1 egg a day, that can reduce your risk of Alzheimer's by about 27%. And that is huge, especially because of the fact that Alzheimer's impacts more than 7 million Americans every year. And that number is growing. And this is because eggs contain a nutrient called choline. And choline helps protect the brain. It also contains omega-3 fatty acids, which helps protect the brain against damage.
All the good things. And it's great for a morning show show as well. As people are dabbing into the breakfast, we have to leave it there. Fox and Friends starts right now.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.